The time right now is 8:48, and if you're a little girl with a prosthetic limb, alopecia, or the skin condition vitiligo, there's a new Barbie doll that looks just like you, still trending on social media. The 2020 additions to Mattel's Barbie Fashionistas line are the company's latest nod to making sure its dolls reflect more of society's diversity. Now, these are diseases and conditions that we should talk about more often. Joining me this morning is Dr. Linda Amerson, who's the owner of LA's Hair and Scalp Clinic. And we're talking about alopecia this morning.
Yes.
All right. And what are we covering?
Alopecia is the medical term for hair loss from any cause. Many consumers, they really do not know the exact definition of that. They think that it means baldness when they hear the term alopecia, but it's the medical term. And that encompasses over 100 different categories of alopecia.
Now, can you be born with alopecia, or can it come later in life?
It varies. It's a case-by-case basis.
Okay.
And it affects men, women, and children. There are some conditions where a person is born with it, predisposition, and then there are other health conditions which also may develop, systemic as well as external. Some people also, they pull out their own scalp hair.
Okay, that has a name in
Yes,
itself.
It does. That's called trichotillomania.
Yes. Dr. Amerson, obviously this is a hot topic for you here in the Metroplex area, and why is that?
This is my passion and purpose, and that is to affect and also impact and help consumers who are affected with alopecia and scalp disorder.
So how are you helping people out?
Well, they come into my clinic for a microscopic analysis, and we're literally getting to the root of the problem. So we're looking at the hair bulb. We can tell them how healthy or unhealthy their hair is actually growing.
So you're just going to pull a few strands of my hair and then...
Sometimes we prefer loose hair strands when we analyze. Okay. We're also looking at the internal structure. We can tell a person what their water absorption looks like,
just
nutritional
by their hair?
absorption. Yes. If they have genetic factors, we can confirm that. There are actually 7 different degrees of severity for the androgenetic alopecia. That's the medical term for that. Also, structural damage, hair shaft defects, just so many things we can see microscopically that a person cannot see with the naked eye.
I mean, for someone that complains of maybe having fine hair or not knowing why their hair won't grow, is this some testing that could benefit them in some way?
Absolutely. It's a case-by-case basis because there's so many different textures of hair as well.
Yep.
Absolutely.
Now, if someone wants to be a part of this process and get the testing, Dr. Amerson, how can they do that?
They can contact me. My clinic is LA's Hair and Scalp Clinic. Our phone number is 817-265-8854, 817-265-8854. And we also have a website, which is hairandscalpessentials.com.
All right, we got to talk about your essay scholarship before we go.
Yes. The Essay Scholarship, this is something we began in 2012, and we're reaching out to the youth, the teenagers between the ages of 16 through 19 who are affected. So they have to write an essay. This year's topic is my alopecia has taught me these things. So it must be 300 words, and then we will select the winning essay contestant, and they will receive a monetary donation for college.
Okay, you're definitely making a difference here in the community, Dr. Amerson. Thank you so much for joining us this morning. We'll definitely get your information on our website as well. Thank you for sharing that.
Absolutely. Thank you for
having me. We'll be right back.
me.
Of course, we'll be right back after this break.
Okay.